Alix Earle is taking Accutane and documenting her entire experience on social media. Today, we're reacting to the videos that she's been posting about her Accutane journey, and we're going to talk about what she's doing right, what she's doing maybe wrong in her Accutane journey, and we're going to cover the side effects that she mentions experiencing. There's a lot of questions online about Accutane, so we're going to break it all down today. I'm Dr. Dustin. I'm a board-certified dermatologist, and if you want to be healthy inside and out and take the best care of your skin and your health, make sure you hit that follow button. Let's get into Alix's videos. First off, I know some people are wondering, why does a girl this beautiful need to be taking Accutane? I'm going to show you a little before and after that she has posted, and we're going to look at what her skin has looked like, and I'm going to talk about some of the reasons why we might put somebody on Accutane. Let's look at this video first. Okay, so we can see in that video, one, she's crying. She's very emotionally upset about her skin. And this is one of the reasons we might consider putting somebody on Accutane is if their acne is having such a significant impact on their quality of life, then that's a reason we want to treat it aggressively. Now, also, we can look at the type of acne that she had going into this course of Accutane. Pretty significant, I would say moderate to severe acne, some cysts along the jawline coming down onto the neck. And this is pretty significant acne. This is acne that is difficult for topical medications to treat. Even prescription topical medications will have a hard time really resolving that the way that somebody might like. Now, we learned from some of her other videos that she's been on Accutane in the past and did quite well for a while, but this is a resurgence, a reactivation of her acne, and it required another course of Accutane. As a dermatologist, I prescribe Accutane almost every day, and we do see maybe 5 to 10% of people who Accutane works for a while, and then the acne does come back, and this tends to happen more frequently if you take Accutane at younger ages and you still have a lot of growth and development and a lot of changes in your hormones. It's possible that you're going to see that come back when you're in your late teens to early 20s. Doesn't happen for everybody, obviously. 85% of people who take Accutane have long-term remission of their acne where it's just not going to be a problem for them anymore. So we're going to look at her first video, kind of starting Accutane. We're going to listen to some of the things that she says, and I'm going to give a breakdown as we pause coming in and out of this video.
We have a lot to unpack here. So I'm just about to finish my first month on Accutane, and I'm going to update you guys how it's been going. This picture was taken in August of my skin texture. It was so painful and inflamed, just like bumps everywhere. Here is more. Okay, last one.
Okay, so we saw some of these photos in the last video. Really quite significant acne. This is definitely on the severe end, and it's hard to tell if she's going to be scarring from this, but I think it's a high possibility that acne this intense could leave permanent scars. One of the reasons that we would treat aggressively is to avoid the disfiguration that can come from significant acne like this.
There's no beauty filter on right now. That's pretty much cleared up a lot on my cheeks. Like, these are just like little scars and marks from it. I started to break out on my forehead and my neck a little bit more. Here's my skin with some makeup on, but you can see the texture is a lot better. And then I took these photos the other night. Here's the other side.
Okay, so 1 month down on Accutane, and she's already noticing some improvement. This is pretty common, but we do see she's still breaking out up on her temples, on her forehead, and we don't expect that somebody who starts Accutane is going to stop making new pimples in that first month. So that's something to be aware of, is that if you're starting Accutane, it doesn't get better overnight. There's definitely still ups and downs, especially in the early portion of your treatment.
Obviously not perfect yet, but I have seen a ton of improvement. The only side effect I have is super dry lips, and like I'm starting to like crack around here. So for dry lips and face, I use this bag balm because it was made for like cow udders, I think. It's really strong. And then this chapstick called Dr. Cordobalm. I have a little Accutane acne list in my Amazon for all of these products. And then the most calming product is this Rescue Balm from Hero. You want to be super gentle with your skin. I used this even before I went on Accutane, like the month before. It feels good, it feels calming, it's not going to like burn your skin like other acne products.
Okay, so we get a little bit of information about the side effects that she's starting to experience just going into her course of Accutane 1 month down. Dryness around the mouth, around the nose, very common area to experience dryness early on in your course of Accutane. We do see a lot of patients that will over time get dry on the backs of their hands, on their forearms, because it's an area that doesn't have a ton of sebaceous glands, so it can get dry pretty easily. And around the mouth, again, common area. So the products that she's using, I'm going to talk about them briefly, but I'm going to make a whole separate video, which I will link to in this video. I'm going to make a whole separate video that breaks down the products that she's recommending on her Amazon storefront, so you can know if they're actually good products and if I would recommend that you use them if you have really dry skin or if you're going through a course of Accutane. But first, she talks about bag balm. Bag balm, people either love it or they hate it, and people that love it, love it. Like, families use it for generations. I feel like it's been around forever, and it has several ingredients that are really good for dry skin, but it does have the potential to be irritating to the skin. And some people really don't like the odor of it. It has a very medicinal smell, like an old school grandma's medicine cabinet medicinal quality, and not everybody's going to want to tolerate that, especially for putting on the facial skin. She does talk about Dr. Dan's Cortibalm, great product for the lips. I do highly recommend that, and I give out samples of that to my patients who are going on Accutane, and they can purchase that, on Amazon, or they can purchase it over the counter. A lot of stores will carry that. It's got a little hydrocortisone in that. It's a very low strength hydrocortisone, so we're not worried about that steroid on the lips. It's enough to help calm down that inflammation while you're on Accutane. And then the Hero Balm that she has there is a really nice, very neutral product, fragrance free. It's going to work great for dry skin, really to help heal and resolve blemishes that you have. It's not an acne medication per se, but it just promotes a healing environment, like putting an occlusive barrier over a wound. Like, we recommend Vaseline in the dermatology clinic. This is just going to be a lot more cosmetically elegant. So overall, good products. I'm a little mixed on the bag balm, however.
Accutane before, so I kind of know the drill. I do drink on Accutane. I know a lot of you guys say not to, and I know you're not really supposed to, but that's just not practical for me. I do get drunk quicker being on Accutane, but I'll just take it slow. My dermatologist said as long as my levels and everything with my blood test is fine each month, then I'm good to go. But I don't know, don't take my advice on that, but that's just what I do.
Okay, so drinking on Accutane. We don't recommend that you drink alcohol on Accutane for a couple reasons. One, alcohol and Accutane are both metabolized through the liver. And so the more stuff that you're putting in the liver, the more, hard it's got to work. And that could be something that elevates your liver enzymes, especially binge drinking could cause acute liver injury while you're on Accutane. Binge drinking on its own can cause liver injury, so we don't recommend that anytime. If you're not 21, you shouldn't be drinking at all. She's over 21, so she's going to consume alcohol. What I do like is that she told her doctor, I am going to be drinking alcohol. That's way better than hiding that from your doctor. If you're going to be on a medicine that could impact your kidney or your livers, we want to know if you're taking other medications, recreational drugs, or drinking alcohol, because it makes a difference. I'd rather have a patient tell me. So in this circumstance, if I have a patient that's over 21 and they want to consume alcohol, my advice to them would be, I prefer that you didn't drink at all, but if you're going to drink, try to keep it to 1 or 2 a week. Certainly don't do more than 2 in a single day on a weekend, for example. If you're going to be drinking enough to get drunk, we are going to check your labs more frequently. It sounds like she's having labs checked every month. If somebody's not consuming alcohol, I tend not to check their labs every single month, just because it's so rare to see any significant elevations in your liver enzymes or in your triglycerides. I tend to check labs when we start Accutane, and then after 1 or 2 months of therapy, enough time to see if it is altering anything. I do appreciate she's told her doctor about the alcohol. My preference is that you don't drink on Accutane, however.
Almost every day of this past summer, bawling my eyes out, and I was so insecure. I did not want to leave the house. I was just miserable. I off my birth control in November, and then I also got my breast augmentation done in January. So I think that both of these combined kind of just messed up my skin, and my hormones were all out of whack when I got my blood taken.
Okay, so we learned a little bit about medical history before she went on Accutane this second time. She went off a birth control medication, and that change in hormones can precipitate acne. Starting certain forms of birth control may cause more acne, and stopping certain forms of birth control and the changes in hormones that causes can cause acne in some individuals. And then going through a breast augmentation, I don't do that procedure, so I'm not aware as much of the types of changes that could cause in hormones. I'm not aware of any significant changes in hormones. However, it is a surgical procedure. It is stressful to the body, and anytime you're going through stress, through surgery, through emotional trauma, whatever it is, that can raise your cortisol levels, that can precipitate acne, and it's going to change other things like your activity levels, your eating habits, your sleeping habits, and all of those things are connected. They play a role in what your skin is going to do. It's part of your overall health. And then this was really emotionally difficult for her to have significant acne. She talks about crying, and again, we saw that in that introductory video where we know that this acne was taking a big toll on her emotionally. That's a great reason to treat it.
Updating you guys, I could literally start crying because just it doesn't hurt anymore. Like, it was so painful. And you guys have been so nice. Like, I obviously don't want to post those things on the internet at all. Like, that is like my worst nightmare. But I know how much of a bitch acne can be, and I feel like if it will help anyone and you can just know that like it really doesn't affect your overall beauty and you will get through it. So much for all the kind comments. It's honestly like the only thing that I'm like blushing right now, but it is the only thing that's like gotten me through this.
All right, so she opens up a little bit. She talks about vulnerability. She is putting herself out there. Nobody likes to look not great on the internet, especially. So the fact that she's willing to post these photos and to tell everybody else it's okay to have acne. This is something that's very normal. She's setting an example of acceptance for significant acne. It is a pretty normal skin condition. Almost everybody gets acne to some degree. So I appreciate that she's willing to get out and tell her story and walk us through her experience with Accutane. So that is the first month over on Accutane for her. And then the next video that she posts that goes over her next step is when she's about to start her third month of Accutane. So we're going to take a look at that video and see what else we learned.
Just got my pills for month 3 of Accutane, so let's do an update.
So 2 months completed.
Right when I started was the beginning of month 2, and I just took this photo, so we're starting month 3.
All right, so again, we saw the end of month 1. This is essentially the end of month 2, starting month 3. She's got her generic Accutane, and let's see what the side effects she's now experiencing.
My lips are like always cracking off my face, but it's manageable. I get bloody noses because it's so dry. And so I've been on Accutane before, and this is my second time doing it. The first time I never had a problem with like my mood or anything, but this time around I keep going through like little spurts of getting like really sad. Like I'll just want to cry, and I'm not like a big crier, so I don't know what's going on with that.
Okay, so again, she talks about the dry lips, very normal. It's manageable for her. She's getting bloody noses. Again, Accutane is going to shrink down sebaceous glands, oil, mucus producing glands, so you are going to get more dry, not only on your skin, but in your nasal cavities. And so dry nose and nosebleeds are more common while you're on Accutane. Given that, you can put Vaseline on a Q-tip and rub that up inside the nose, or Aquaphor. You can sleep with a humidifier in your room, and that will help to moisturize the nasal passageways and help limit bloody noses. If you're getting significant bloody noses very frequently on Accutane, we do recommend talking to your doctor about that, because you might need to have something cauterized if there's a more significant problem than just a routine nosebleed once or twice a month. Now, the next part is interesting. She talks about feeling more sad or depressed while on Accutane the second time, but it didn't happen the first time. Now, this is something, if you Google Accutane side effects, you're definitely going to read about all these cases of depression, and Accutane has been really well studied in this because it's been in the news many times. But in the way that they designed these studies, they looked at groups of people who took Accutane and their rate of depression both on and after Accutane, and they took a matched group who did not take Accutane and looked at their rate of depression. And there was no difference between the group that took Accutane and that did not take Accutane. This was thousands of patients. And so this has been studied even more than that, very similar study designs. And overall, we can then confidently say that at a population level, Accutane does not cause depression. Now, it is very easy to find anecdotal reports, one-offs here and there, where people say, I took Accutane and it really killed my mood. I was very sad. Or some people maybe even stopped the medication because they were feeling so down that they might have decided to hurt themselves. So Accutane, we can't say causes this, but will you find reports here and there where somebody believes that Accutane caused that for them? Yes, absolutely. I've prescribed medications where I had no idea somebody could feel depressed on it, like spironolactone. It's another common medication we use for acne. And somebody came back and said, man, I've just felt really, really down since I started taking spironolactone. I've never seen that side effect in any patient before. So anything is possible in an individual. But what I want to reinforce is that by and large, we don't have any data that suggests that Accutane causes depression at a population level. Now, what we do know is that people go through changes in their life. And at this point in her life, she's a little older. There's potentially more stress. She's now very much in the public spotlight. And those types of things will play with your mood a little bit and may be reasons why you might feel more depressed from time to time. We still can't say that it's the Accutane causing that for her, but it's important that she talks about that with her doctor, because we do always want to ask and monitor for the risk of depression while you're taking Accutane, because it's in the label. But again, it doesn't cause depression.
Let's talk about drinking on Accutane.
Back to this.
The psychologist was like, you know what, you can have a drink, have water in between, take it slow. That's not always exactly how I do it. And listen, I know, and I'm not saying you should drink on Accutane. I know that I do, and I know it's not good for your liver, but I do it. But the first time I took it, I didn't see any side effects with that, and this time around, I literally get so drunk off of one drink, and if I drink too fast or if I take shots or anything, like, I will get sick. So I have been drinking less just because it doesn't make me feel good. To listen to your own body, though.
Okay, so drinking, again, we've already discussed this. She's a little older. Most people report that the older they get, the less tolerant they are of alcohol. And so it's no surprise. I don't think that her liver's really having any trouble because the doctor is measuring that every month. So it could just be that she's a little bit older now and maybe isn't metabolizing the alcohol quite the same way. But again, we don't recommend drinking, especially to full inebriation, while you're on Accutane.
I can go longer without washing my hair because you just don't have any oils. The last time I did Accutane, I feel like I lost a lot of hair, but my hair has been growing a lot right now, so it's not affecting that.
Okay, so you are going to be more dry, just like we talked about the nasal passages, the skin, but your hair is going to be less oily as well. So she's not needing to wash her hair as frequently. And she thought that her hair did thin while she was taking Accutane the first time, but she's not noticing that now. Again, this is one of those hit or miss side effects. Some people really feel that Accutane causes thinning of their hair, and there is data to support that. We do know that these retinoid medications can potentially thin your hair, can cause some hair loss. That tends to be very temporary, and so when you stop the medication and your skin recovers, you're going to regrow that hair. This is a medication-induced phenomenon. Now, for some individuals who are maybe taking this in adulthood, it may precipitate more long-term hair loss, but that was already going to happen anyway. We maybe just sped the process up, is the current thinking on it. But this time she's taking Accutane and not noticing any thinning of her hair. So it is not a side effect that happens to everybody, and it doesn't happen every time.
It started on 20 milligrams. Last month I did 40 and now I'm doing 50. I took the beauty filter off. I obviously have some scarring, but it's actually getting a lot better. I was so depressed this summer because of my skin, and I have never been so insecure in my life. But you have to remember that no one cares about it as much as you do. No one probably even notices it. Like, right when this all started happening to me is when I first started hanging out with Tyler. And like, if he was really that disgusted by it, he would have walked away, but he was like, I literally don't even notice it.
So this is an important point to make. Most of us are way more critical of our own appearance than anybody else will be of our appearance. And so when you have an imperfection in your skin, in your appearance, your hair, whatever it is, you're going to fixate on it a lot more. And as much as we want to believe that people pay a lot of attention to us, that's not always the case. Sometimes people aren't paying that much attention and they don't notice the things that we notice. They're not inside our head. You have these voices telling you that maybe you look horrible because of the acne or the hair loss or the scar or the big blackhead, whatever it is, but a lot of other people aren't paying attention to that. And so you really should cut yourself some slack, give yourself some grace, and know that the things that you perceive to be wrong with your appearance are probably not a big deal to most other people. So I appreciate that she talks about that. She even talks about how Tyler, whoever Tyler is, did not find this an unattractive quality for her. So that's important. She's being vulnerable again and talking about the way that she felt. The depression that she talks about here is depression that she experienced before starting Accutane. We've already touched on this, so I appreciate her sharing that.
Everybody knows that acne doesn't stay there forever, and that's normal. The more that we start to normalize acne and having imperfections in your skin, the less insecure people are going to feel about it. Like pores, bumpy skin, texture, scars, acne, all of that is normal, but everything we see is just so photoshopped and fake. So if you're dealing with this or you're insecure about something with your skin, you're normal. You're fine. You'll get through it. Do not stress. You're beautiful. Cannot recommend this enough. It's linked
back to the bag balm,
the dry skin, dry lips issue. Also, if you're breaking out, I feel like less is more. Just calming, gentle things. Don't like scorch your skin. This is also linked in my Amazon. It's really calming and soothing, and it helps with like the redness. Wish me luck with month 3. I'll keep you guys updated. Bye.
All right, so again, she touches on the products. The next video that I put up is going to be all about the products that she's using and recommending on her Amazon storefront. I do want to reinforce her message to be positive and have self-confidence in your own appearance, your image, because nobody else is as concerned about it as you are. You are great. You're an important person. You are a fantastic individual, and you're beautiful just the way that you are. It's okay to want to improve your acne or improve something else about the way that you appear. Don't let it negatively impact the way that you actually feel about yourself. yourself because you're the same person before and after going through any medical treatment, any surgery, cosmetic, procedure, whatever it is. So I just want to reinforce that. I see it every day in my clinic where people are really concerned about something that even I perceive as very, very minimal as somebody who professionally looks at skin, where if I passed them in the grocery store, I wouldn't even notice this thing. Again, I appreciate Alix being open and vulnerable about her Accutane experience. I'm sure you guys have questions about Accutane, and so I want you to leave those in the comments for the video here because I will be trying to answer your questions in the comments, and we can do follow-up videos as Alix continues to post more information about her course on Accutane. Again, I'm Dr. Dustin. Thanks for watching, and I'll see you on the next video where we break down her recommendations for Accutane skincare.